Thank you for joining us all today on our weekly COVID-19 update. We have Dr. Michael Mendoza joining us today as well, and so we're going to get right into it. A couple things to start with. As we all saw yesterday, Governor Cuomo announced the lifting of the orange and yellow zone designations across the state, and that includes the zones right here in Monroe County. The decision is reflective of where we are now with our response and where we are in respect to our case numbers, our positivity rates, and our hospitalizations. But one thing I want to make clear is that we're really still not out of the woods yet by any means. But it's a good thing now, and it's a demonstration that our numbers are coming down, that the community is operating together. We're following the guidelines, and we're doing the right thing, and the numbers are responsive to the actions that we've been taking. So these new set of rules, I think this is a good thing that the zones have been lifted because it puts us all operating under one set of rules. And I think it reduces some of the confusion between orange zone, yellow zone, no zone, and it reduces some of the disparities in the rules that have been taking place, particularly amongst some of our small businesses. So I think this allows more flexibility, and I think it puts us all under the same set of rules, and I think that's a good thing. But let's also be clear what the elimination of the zones means. It doesn't mean that we're all moving around as if none of this has ever happened before. We're still in the middle of a pandemic. So it means that hair salons and other personal care services, they can reopen. It's at 50% capacity. Restaurants can have indoor dining at 50% capacity with a maximum of 10 people per table. Gyms can reopen at 33% capacity. Houses of worship at 50% capacity. Schools are relieved of the zone-related COVID-19 testing requirements. Gatherings of more than 50 people in public spaces are still prohibited, and no more than 10 people in private gatherings. I think this is reflected of the fact that we're still in the middle of a pandemic, and while the numbers are heading in the right direction, and that valve is being opened and loosened, we still need to make sure that we are following the guidelines and we keep those numbers headed in that right direction. We can all see the light at the end of the tunnel. And while we're ramping up vaccinations, we are all very eager to get back to normal. But the truth is, we're still just not quite there yet. And so to show that, we want to look at a few of the metrics that we have in Monroe County. And I think this will help to demonstrate why the zones and why it was appropriate for the zones to be eliminated, but also shows how quickly things can change in the right direction. So we're going to try to share a few slides. Yesterday, the 7-day average of new positive cases was at 315. That's the lowest 7-day average we've seen since right around Thanksgiving, when we reported an average of 309 on November 23rd. Yesterday's new case total was 366, and on Monday, that was 193, the lowest in nearly 3 months since we had 161 cases on November 5th. Our 7-day positivity rate yesterday was 4.6, the lowest it's been since November 26th, when we reported a positivity rate of 4.5. This may all seem repetitive, but I think it's important, though, that we really see how effective we have been in tackling the surge and how the direction is really heading back down, especially if you look at the average line. Remember, we always talk about averages as opposed to looking at one-offs in the day-to-day numbers. Follow the average. And if you can look back into late October and early November, what we saw was a dramatic increase in the number of cases, but also in the average. Started going up very quickly, but then has come back down the other side of that hill. So I think that that's a very good sign. We're also seeing an improvement in our hospitalization numbers. They're high, they're still too high, and they are lagging indicators we often talk about the health of the community, because you get your positive cases first, your rate goes up, your positive cases go up, then the hospitalizations go up a couple weeks after that. And that's what this trend line has looked like. If you look at where our positive cases were going back up in that mid to late November, the hospitalizations started going up at that rate just another week or two behind that. So the hospitalization numbers are starting to come back down. It's just a little bit behind. There were 662 people hospitalized across the Finger Lakes region yesterday. I believe that number is going down again today. and these are the lowest numbers we've seen since December 11th. Again, remember, it looks like it's about 2 weeks after the high mark that we had back in November with our cases. It was December 11th was the last time we had this number, when 639 people were hospitalized. Now, I want you to also put it in perspective. Just a week and a half ago, there were 778 hospitalizations. So we've actually seen a fairly dramatic reduction in that number over a very short period of time, which is, again, why we want to look at averages. What this shows us, I think, is that we still have work to do as we're spinning up the vaccination efforts. We're heading in the right direction, though, and that is very good. And I want to thank everybody across the community for working together to do that. We just have to stay on this path, keep that effort going so that those numbers can continue to go down. As those numbers continue to go down, that is why it makes sense for the yellow and red zone, the yellow and orange zone designations to go away. The trouble area would be if those numbers start to head back in the other direction. We don't want to see those designations and those zones have to be placed and imposed back on us. So let's keep everything heading in the right direction. As you know, we also started the vaccination at the convention center last week for those who are eligible under phase 1A and 1B with appointments, and we continue to vaccinate people at the Fleet Center as well. Both of those locations are appointment only for phase 1A and 1B essential workers, and our ability to administer those vaccines completely is dependent at this point on the weekly vaccine allocation. I've said this a number of times, I'm going to repeat it. We had said it earlier this year, because we could not control how much vaccine comes into our region that is managed by the federal government, that pushes the supply to the state, that then pushes it down into the regions. We can't control how much supply there is, but what we can control is our ability to put it into arms. That's something we can influence. So we work on what we can do and what we can influence. And so we set a goal to make sure that every week, the amount of supply that we receive, we have the capacity to administer week to week so that we don't ever build up a supply here. We get it into the arms as quickly as possible. We have met that goal, and we continue to meet that goal, and we have that goal met for this week. On Monday, earlier this week, the state held a pop-up vaccination site at Mount Olivet Baptist Church on Adams Street to help make sure that vaccines are being provided equitably across the state. The site provided over 200 vaccinations. We're very grateful for our partners, the governor for his commitment to equity and fairness for all people in our community to receive the vaccine. And I also want to thank our community partners. This was really a community collaboration to get this done between the state, the county, the city of Rochester, the church leadership, and the hub. And so I want to thank all of them for putting this together this past Monday and working together. I know there's still a lot of anxiety about when people will be able to get the vaccine. And unfortunately, we still do not have all the vaccine that we would like to have. We don't have all of the answers as to when enough vaccine will be here to get to everybody. But what we will do is continue to make appointments as the vaccine becomes available, and we'll continue to make sure that week to week, the vaccine that does come into our community gets into arms as quickly as possible. We really need to work together as a community to understand that and not mistake the difference between eligibility and availability. Right now, we're in a situation where there are a lot of people in our county, our region, and the state who are eligible to receive the vaccine. There just isn't the availability of the vaccine to put in their arms. So we have to be patient. We have to work together. And we also have to understand, even as the vaccines go into people's arms, that doesn't mean we have a green light to move around the cabin. We still have to, as if we're back to pre-pandemic activities. We still have to wear our masks. We still have to stay socially distanced and follow the guidelines so the numbers continue to go down. I also would like to remind the community that the county is continuing with its testing locations and the rapid testing efforts. The link for next week's testing sites will go live tomorrow at noon. So remember, every Friday at noon, the appointments for the following week will go live. We have seen a reduction in the number of appointments that are coming in at some of these locations. So I want to remind the community, we need to keep up that testing level to make sure that we're finding these positive cases and getting people quarantined and isolated appropriately. So Please utilize these rapid testing sites. They're free. These are rapid tests. Results come back in very quickly. These aren't the PCR tests that are uncomfortable and go right to the back of your nose. These are the ones that just go in the front of your nose and come back very quickly. So they're easy to do. They're completely free of charge. And if you don't make an appointment but would like to still come on into one of the sites and they'll take care of you. They work very hard to get to everybody, whether you had an appointment or not. But it is helpful to make one, but it's not required. So with that, I'll turn it over to Dr. Mendoza for his update.
All right, very good. Thank you, Executive Bello, and thank you again to all of our colleagues in the media for joining us today. I wanted to touch a bit on some of the high points of what County Executive Bello mentioned just now regarding the numbers. I agree. Our numbers are heading in the right directions. Our positivity rate as of today, 7-day average, is now down to 4.45%. We haven't seen that rate since November. We will be reporting 318 new cases today. Overall, that is a reduction, a trend that we're seeing, again, very consistently across the board for the last several weeks. And so I think in balance, things are heading in the right direction. We still have a number of people in the hospital. That number is improving slightly, not yet improving as quickly as we will expect it will be in the next couple of weeks. And again, the reason for that is because hospitalizations are a lagging indicator, if you will. And so we won't see the impact of the changes that we've made recently on hospitalization numbers for another week or two. I also want to remind the community that we, on average, have an older population per capita, and so that is partly the reason why we have those higher hospitalization numbers and why the hospitalization numbers won't yet go down right away. We are also, unfortunately, going to be reporting 35 additional deaths today. Those deaths span the dates from January 8th to January 24th. So I want to spend some time talking about higher risk sports. As you all heard late last Friday, we were informed that higher risk sports would again be permitted in New York State with collaboration from the local health department. I stated last Friday, and I will state it again, I'm generally very supportive of high school and higher risk sports continuing here in Monroe County. For the past several days, I've been working very closely with my counterparts both here in the region and across the state, trying to establish all of the guidelines and all of the procedures and all of the parameters through which we would be evaluating this decision. And here in Monroe County, because I believe currently we have no evidence of the new strains of the COVID-19 virus here, because I'm confident in the schools and their ability to implement the NISFA and the state guidelines, and because I'm confident here in our staff that we will be able to closely monitor the numbers as things reopen, I'm very supportive of higher risk sports reopening. That being said, this does present an additional risk. And I do think that in order for us to continue to enjoy these higher risk sports, for our athletes to enjoy these higher risk sports, we all need to do our part, because the best way to keep COVID out of our sports activities is to keep the levels of COVID in general in our community low, which means that in the face of now reopening restaurants and places of worship, it's incumbent upon all of us to make sure that we're wearing our masks, that we're keeping our 6-foot distance, and that we're being very careful about the gatherings that we are engaged in, particularly private gatherings in our homes. And so the last point I wanted to talk about a little bit was just the vaccine effort. I share the county executive's feelings that we would love to be giving far more vaccines than we are. I long for the days that we can give thousands of vaccines every day at the convention center alone. We have the capacity, we have the staff, we simply do not yet have the vaccine. This week for Monroe County Health Department, we received 1,500 first doses. 500 roughly of those will be provided to members of our law enforcement community. Those appointments were scheduled last week. And the remaining approximate 1,000 will be offered or have been offered to our teachers, local teachers in Monroe County. We've opened up links each of the last 2 days, and we'll be opening up another one today for roughly a third of that supply each day. and that supply has gone very, very quickly. We've not been able to keep up. We're exhausting the available appointments within minutes. And so we certainly want to have more vaccine. We're certainly prepared to administer more vaccine, and we're waiting to see additional supply coming in from the state government. So with that, I will pause and turn it back over to Julie to take your questions. Thank you.
Thank you. Jennifer Lukey, WATC, you're first.
Hi, Dr. Mendoza. I was trying to put my camera on to say hello, but it's not letting me. So you just get my voice today. I was hoping to circle back to high school sports. You said you're having conversations. The state said they could start as soon as Monday. So what is the plan? Are you anticipating additional testing? Because I know a lot of the schools yesterday, you were told they don't have to do it anymore because we're out of the zones. So I guess I'm just looking for some clarity here for parents, one, who are eager to get their athletes back on the field and on the court, but two, just schools in general about the testing requirements.
Sure. So as we've said, the testing requirement is no longer because the schools are no longer in the yellow or orange zones. Part of the consideration around testing is that we wouldn't want to require something that wasn't going to be available across the region, because we know that a lot of these high-risk sports end up being very regional. And so it turns out that there isn't that supply for testing uniformly across our region. And so we didn't want to implement any kind of testing requirement. And quite frankly, I don't think it's necessary. I think provided that everybody listens to the guidelines that were offered by NISPA and the state health department, I don't think that testing will add that much more to the safety. I think the majority of the safety of these events is in our own hands in terms of what we do. And so I would make a direct plea to our athletes and their families, particularly those who are involved in wrestling and football when that comes to be the higher contact, higher risk sports, to be very, very careful. The vast majority of the transmissions we've seen have not been on the court or on the ice, but they've been in those private gatherings before and after our athletes are competing. But in general, I don't think that there is a uniform role for testing with regard to high-risk sports.
So just to clarify, can they start on Monday then here in Monroe County?
Yes, so I will be issuing later on today our final statement. But yes, I am supportive of higher-risk sports beginning this coming Monday.
Okay. And my follow-up, and Dr. Mendoza, I know this isn't really your realm, but there is big news today on a state level about the nursing home numbers. What is your reaction to that?
Well, you're right that it is not fully within our realm, but I do care very much about our nursing homes. Ever since the beginning of this pandemic, we, for better or worse, have had a supportive role in the nursing home efforts. We are there to help with providing PPE, with guidance. We'll do contact tracing for the employees within the nursing home, but the nursing homes themselves work directly with the state health department, and the process for reporting data is fully through the state health department. We get some information somewhat anecdotally after the fact, but in general, I care very much about our nursing home population. I'm very eager to get them open when it's safe for visitors, but certainly it's very concerning, and I'd like to learn more about the process so that we ensure that we have that level of transparency in terms of what's happening in our nursing homes for our public here in Monroe County.
Thanks.
Next up is Brian Sharp from the Democratic Chronicle.
A rarity, but I actually don't have any questions today.
It is a rarity. Thanks, Brian. Do we have someone from WROC on? Okay, we're going to go to you, Andrew Dennis from 13 Man.
Hey guys, Dr. Mendoza. Hey Adam. Dr. Mendoza, wanted to ask about, I know again, this might not be exactly your realm, but there has been some concern about healthcare workers, not enough of them getting this vaccine. Have you been talking with the health leaders for both URMC and Rochester Regional about how they can better make sure those who are, I guess, reluctant to take it are making sure they take it?
Yes, we are in constant communication, if not every day, multiple times a day, with the leadership from both of the hospital systems. They want, just like everybody else, to ensure the safety of our loved ones who are hospitalized in any of our local hospitals. The uptake within healthcare workers, I think, has been very robust. We know this because the absentee and sick calls for hospital workers has come down. So there are promising signs, but I do know that not everybody has gotten that shot. And I think it speaks to the diversity of our community. It speaks to the fact that there's still a lot of questions that we want to answer. I think it's symbolic of a lot of the questions that we will want to answer for the community at large. But from my standpoint, if you work in a healthcare setting, I want everybody to ask your questions and ensure that you get appropriate answers so that you make the right decision. Because at the end of the day, I want to see as high a rate as possible of COVID vaccination in all of our healthcare settings.
And Dr. Mendoza, a follow-up to that is the CDC, Governor Cuomo continuously brings up, and I'm sure it's on your radar too, is these other strains that are more contagious that we're starting to see from other parts of the world show up in the US and potentially at some point here in our region as well. Is there a worry there that, A, is there a worry period about it? I'm sure there is, but B, that if not enough healthcare workers get vaccinated, we could be in a really bad place with the hospitals. Even right now, as numbers go down, that's something that's looming.
Well, this is actually very reminiscent of where we are, or where we were literally 12 months ago today. We were entertaining the possibility and the reality of a virus coming in through our borders from other parts of the world. And so here we are again with 3 new variants of relative of the initial strain. But I think we now should know that we've learned a lot in the last year. We know the role of masks, we know the role of physical distancing, and we have to implement all of these same tools to keep these new strains of the virus out of our community. There is still somewhat early evidence that the vaccines that have been given so far appear to be effective for at least some of these new strains, but there is still a lot of science coming out and still some more that we are learning about how well the current vaccines will protect against these. So until we have that information, we ought to do what we know works: wear our masks, keep our distance, and follow the guidelines around those gatherings.
Thanks, Dr. Mendoza.
Seth Voorhees from Spectrum is next.
Yes, hello. Yeah, I know this question was answered by the county executive with a statement the other day. Some in the Monroe County legislature want to have the county take over distribution of vaccine doses. I guess I'm looking for a response maybe from both of you. Would this make any sort of difference at all?
Yeah, I think the county legislature has the leadership there had a fundamental misunderstanding on the role of the county, the state, and the federal government. The federal government creates the supply, working with the manufacturers of the vaccine. That's what the whole last year was all about, was creating the vaccine and creating that supply. The federal government then distributes that by whatever formula they use, down to each state, which then pushes it down to localities, which are then putting it in people's arms. And that's what we're doing. So here on the local level, I appreciate their confidence that we can do this here, and we have done this here by building up that capacity to administer it as soon as we receive it. But the counties do not have the ability to manufacture vaccine. That's done on the national level. And frankly, we need more vaccine. This is something that, I think they weren't prepared for on the national level to be able to meet that demand to have enough supply. But here on the local level, we've set a goal is to focus on and work on what we can control. And what we can control here is our ability to put it in the arm when it arrives. So I'm proud of our efforts here that we've done that. I think that's working here. But at the end of the day, the real challenge here is when the federal government sets out a policy that first of all, that makes far too many people eligible for the vaccine than there is vaccine to put in the arms. It creates an expectation that it will be there when there isn't enough supply. So we're working through those issues. We're asking the community to work with us on that and keep politics out of the process, but instead talk about how we work together as a community to get the job done.
And the only thing I'll add is, from my standpoint, I feel like we have very close collaboration already here in Monroe County. And multiple people are leading it. The hub is leading their portion, and certainly we here in the health department are leading our portion. As the county executive said, the limiting factor right now is vaccine. And frankly, all I want is more vaccine so that we can get it into more people's arms. And so we will take responsibility for that when the vaccine comes. But at the end of the day, I think there's a lot of collaboration already happening here. And I think we've done as well as we could with the limited supply of vaccine that we've received today.
On that topic, are there any major concerns, either short-term or long-term, with the vaccine supply issue?
Yeah, I mean, well, short term is really the issue is this, is that we just don't have enough supply, right? So when it comes here, we put it in the arms really as soon as it gets here. And frankly, we've been leading the country in this. You know, if you look on the national news and how that tracks across the country, you know, I don't know, I saw reports a few days ago that showed only maybe half the vaccine that's been shipped out to the states has been administered. In New York State, that number is routinely much higher, into the 80s and 90%. And New York State put a vaccine tracker on the website. So again, we're looking at transparency there as to where this vaccine is going and how much is going out. So you can track by region in New York how much the state has received, how much each region has received, and how much has gone to someone's arm. And it is by far a much greater percentage going to arms here in our region and across the state than you see in other states and in the national numbers. So I think that part's working. Getting it into arms and getting it as quickly as you can distributed out is working. The real issue here is the supply, and that's what's managed by the federal government. But I'm optimistic because, you know, the president announced earlier this week the intention to purchase additional doses and hope to have additional supply by the end of summer or early fall to be able to vaccinate anybody who wants a vaccination, so we can do the full population. So if that's the case, that continues on that trajectory by late summer, early fall, then what our job is on the local level is to then make sure that those networks and the collaborations Dr. Mendoza talks about, but those networks continue to build out so that as that supply increases and the expectation increases, that our ability and distribution networks increase with that as well, and we stay ahead of that. So that's what we're going to be working on. But I think President Biden is correct in focusing more on how do we increase that supply and how quickly can that supply be increased.
All right, Eddie Singer from Minority Reporter.
Hi, I'd like to talk about the schools for a second. So with the return of the high-risk sports, and I don't have kids in school, so I may not know the answer to this, why I'm asking it. What about the non-athletes and the activities that they return them to normalcy as well? What are guidelines for that to make sure that those can be done safely and that we're treating our non-athletes equitably as we're treating our athletes?
Yeah, I understand that there is guidance under development. Certainly we want to support extracurricular activities equitably. I was a participant in both performing arts and athletics, and I can attest to the value of both, and that they are both complements to the extracurricular experience that our students have. You know, but one thing had to go first, and for whatever reason, athletics went first. But I'm very eager to learn about what is in store for the performing arts, and we're eager to implement whatever guidelines come from the state health department and other authorities. And so when that time comes, we will engage in the same collaboration that we've had all along with our schools to make it happen and ensure the safety and health of our musicians and performers.
I want to go back to hospitals as well. And so in the past week or so, the percentage of people in the ICU has been around 20%. What is that number telling us about the severity of illness? And also, how do we gauge that to know what our capacity is going to be? I mean, how long are people staying? And 20% of people are in ICU. What's that saying about severity of the people who do need to be hospitalized?
Well, it confirms what we've known all along, which is that COVID can cause very critical, serious illness. The individuals who are now admitted in the ICU were generally admitted some time ago, were infected weeks ago, and we're pulling for them so that they can have a healthy recovery and get back to their loved ones. But the ICU admission rate is an even further lagging indicator behind even hospitalization rate. And so I won't expect that number to change very drastically in the near future. I think hospitalization numbers will decline first, and then hopefully we'll see people in the ICU going home or going to rehab or whatever facility after that. But it just reaffirms what we know, which is that COVID illness can cause very serious illness. And, you know, we wish and pray for all of those individuals to make a speedy and healthy recovery.
Thank you.
And our final question today comes from Gino Finelli at City Newspaper.
Hi, how you doing? Adam, I wanted to ask you a question from the Republicans' press conference this morning about restaurant service fees for the year. They had just presented legislation to cancel 2021 fees. They had claimed that you had done nothing essentially about the fees, but I talked to some Democratic legislator and she said the opposite, that you actually had been in talk about those fees for a couple months. So can you speak a little bit to that, whether or not you were aware of that issue and were involved in it at all?
Oh, 100%. Yeah, no, this is something we've been talking about the last couple of weeks. And it's something that has been in the works to do. I think it's a good idea. It's something that we've been talking to, in particular, Rachel Barnhart in the county legislature about, and who brought this to us as an idea several weeks ago. And I think this is the right thing to do. I think that restaurants, you know, they need our help. They're struggling. And, you know, this is why we did the small business grant program last year and helped. We did a small business loan program last year. And we really tried to work with particularly our small business community because they've been incredibly hard hit over the last really almost a year at this point, but particularly those in the orange zones that have been really limited in what they can do. So, Gino, it's absolutely correct. We've been working on this for just the last few weeks. You know, not to let facts get in the way of a good story, but that's the truth of how this played out here. Yeah.
Thank you.
No follow-up question, Gino?
No, I'm good.
All right. Looks like we're all done.
Thanks, everyone.
Thank you, everyone. Have a good day.